So a heaving apex was one of my major problems when I was doing some courses under cardiology. So I said let me make a video on it. Alright. So the apex of the heart actually has what? A position where it should be. I think they define it as what? Fifth intercostal space. Is it 9 centimeters from the midline or something like that? But just know that what? In a heaving apex, the apex of the heart is now up, maybe around this region. Now, what could make the apex of the heart, that pointing mouth of the heart that's supposed to be here, to come here? Is when the heart is enlarged. And that's usually what? Left ventricular hypertrophy. So it's just a simple concept. All right. But let's look at it. We said that heaving apex refers to what? An abnormal upward displacement of the apex of the heart, and is often indicative of left ventricular hypertrophy. That means the left ventricle has become very large. Okay, so now you try to feel the heart here, but you're not feeling it here. You are feeling it somewhere up. Okay, so this sign is dictated during a physical examination by palpating the apex beat, which is the point where the heart contraction is most prominent. All right. So you try to feel it in the fifth intercostal space and you can't feel it there. You are feeling it up, like in the fourth intercostal space, right? It's usually the problem. So what are the things that could cause a heaving apex? We've mentioned left ventricular hypertrophy, but it's not limited to it, okay? If we say heaving apex, it could also mean another thing, like a dilated cardiomyopathy, hypertrophic cardiomyopathy. There could be a heart failure. There could be a valve disease, like aortic regurgitation, mitral regurgitations, and all the stuff, right? So now, what are the characteristics? How can you classify a heaving apex? There will be upward displacement of the heart apex, of the apex beat, right? So the apex beat will no longer be felt in the fifth intercostal space again, but somewhere upper, right? There will be increased forcefulness of the apex beat because the heart is having some problems, then it's now trying to overwork itself. There will be prolonged duration. There will be a sustained or double impulse, okay, beats, right? So clinical signification, like significance now. If you notice a patient with a heaving apex, it could mean some things, right? So those are the meanings you're trying to look at. It could mean that there's a left ventricular enlargement. It could mean that there's increased cardiac workload or heart failure. It may also be associated with signs of heart disease such as what? Heart murmurs or gallops, right? So I think that's heaving apex. So there's a medical student out there being confused like the way I was, at least you have it, right? So heaving apex, the definition, causes, characteristics, clinical significance. That's it.